Well, hello, everyone, and thank you so much for joining today's Be Safe in the Hospital webinar. My name is Sarah Miller. I'm our Director of Partnerships here at the Patient Safety Movement Foundation, and we're pleased to welcome Ariana Longley, our Chief Operating Officer, who will be giving today's presentation. Before we get started, I will go through the agenda really quickly. Next slide, please. Perfect. So quick agenda, we'll start off with giving a brief overview of who we are here at the Patient Safety Movement. Your safety in the hospital, free resources that we provide as well as external resources, COVID-19 resources, and then question and answers at the very, very end. Before I pass it over to Ariana, a few housekeeping items. You have all been muted upon entry. Therefore, you won't be able to unmute yourself throughout this presentation. So if you have any questions at all, feel free to pop them in the question and answer chat at the very bottom of the Zoom. If you kind of hover over, you'll see kind of near the end screen. So pop your questions in there. Feel free to use the chat features throughout this presentation to chat with your fellow attendees. And we'll have 15 minutes at the end to ask Ariana any questions that you might have. So with that, I will pass it over to you, Ariana.
Thanks so much, Sarah, and welcome everyone who's joining live, and hello to anyone who might be tuning in on YouTube later. As Sarah said, we're going to start with who we are. So as I move over, the first thing that I'd like to do is kind of ground us for today. So I'm going to share with you a patient story. This is Carol Hemmelgarn talking about her daughter, Alyssa. So this is about 5 minutes long. I'm going to let this play, and then we'll pick up from there afterwards.
Your one job as a parent is to protect your children. And so, Alyssa was diagnosed with leukemia on a Monday afternoon, and she died 10 days later. You do not die of leukemia in 10 days. She died of medical errors. She got a hospital-acquired infection with a C. diff. There was a boy in the room next door to her in this hospital. They shared bathrooms, and he got C. diff and died, but I didn't find that out until months later. She became septic, but they had ordered lab tests to look at this, and when the lab tests came back, they showed there were critical values, and no one acted on them. They did last rites before she went into surgery. And to sit there and think, you might not get your child back again. But she came out of the surgery, and it was then that they told us there's nothing they could do. She died a painful and a horrific death. One of the hardest things, it's the loss of hopes and dreams. What would her future have looked like? What was her career? For so long, I couldn't take a family picture because I couldn't have that missing piece. I fought for years to try to get answers. And that is inhumane, to treat someone that way after you've had a loss. And it took the organization 3 years, 7 months, and 28 days to meet with me and have the first real honest conversation. And one of the biggest gifts anyone can give us after a loved one's been harmed is transparency. The first thing is tell us what happened. The second thing is take accountability. The third is I'm sorry. Those words are so powerful, and if they're genuine, I don't know anyone that when they've heard them just doesn't break down and cry. The fourth is tell us how you're going to fix the problem. One of the things we need to know is if we've lost a child or a loved one, and we know it's happened again, then it's like their loss was in vain. But the fifth one that I think is becoming more and more important is, let us be part of the solution if we want to be part of the solution. And for a couple reasons. For some people, it's a way to know the problem was fixed. For others, it's a healing factor. And for some, it's a way to honor their loved ones.
So that was the story of Alyssa, and Carol remains part of our network, and we thank her so much for being involved and sharing her story, sharing Alyssa's story. And that gets into who we are. That's why I like to always start with a patient story. Our vision is to achieve zero preventable patient harm and death across the globe by 2030. We're not focusing on 99% reduction. We're focusing on 100% reduction, zero. We can't have other Alyssas out there like that. And so our mission is to urgently unify people and collectively improve patient safety across the globe. I really loved what Carol said. There's all sorts of different ways that patients and families can get involved. It might be a healing thing. It might be knowing that there's closure, that the error won't repeat itself. But everyone working together, whether you're a patient or family member, a layperson, a concerned citizen, maybe some of you today, administrators who maybe you're on the phone today, how can we all work together to urgently unify people with this goal in mind? So if you don't know the patient safety movement very well, we have 3 core competencies. These are the things that we think that we do very well. We forge global relationships, partnerships, and collaboratives to actively promote change for patient safety, working with as many groups as possible. We have over 100 partners across the globe that we work with. Second is we develop and disseminate patient safety education to governing bodies, healthcare professionals, students, patients, families, and the public. If you've known about us for a while, we used to heavily focus on educating people within healthcare, and that still is very important to us. But we also realize that events like this, where we can educate lay people, is equally important. We have to have people understand this issue and hopefully kind of get into the grassroots movements and groundswell of public support. So this is one of those things that we do under our core competency number 2 is these webinars for the public. And third is creating public demand for safe and highly reliable care. We want each person to demand safe and highly reliable care when they go in to seek care. And so that's a little bit about us, just a sprinkling of it so that you know who we are as we get into your safety in the hospital. So first, I'm going to go through some facts about patient safety and medical error. The other thing I'd like to say is I am not a clinician. I do have a Master of Public Health degree, but I have never cared for a patient and won't unless I go back to school here. So just consider that when you're asking your Q&As at the end. If there's anything that I can't answer, I will note it and try to have someone who has those credentials help answer it later. Maybe I can email you later. So just keep that in mind as I present these facts. I have worked for the Patient Safety Movement Foundation for the last 6 years. So let's start with just what medical errors are. So the definition that we use is a medical error is an unintentional, preventable adverse event, whether or not it's evident or harmful to the patient and leads to unsafe care. And medical errors are most often made by health workers who mean well, but operate in a healthcare system lacking systems and processes that are highly reliable, like aviation, nuclear power, and oil. So this is really important. We really want to protect those health workers that are in a system that is not highly reliable. They're doing their best. They go into work every day trying to do the best for their patients, and yet the systems that they're operating in and working in don't allow them to do that very well. And so in aviation, in nuclear power and oil, those are model industries that healthcare can kind of emulate over time. And that's what we really want to try to push here at the patient safety movement. So we have some examples of what medical errors might include. And so this is sometimes helpful in making you realize, oh, this might have happened to me, or my neighbor had an example like that happen to them. So one example, your son tests positive for COVID-19 and is admitted to the hospital. Due to the lack of masks, your son's caregiver isn't able to stop the spread of infection and is also infected. This is preventable, and that's a medical error that could be prevented. Second is your grandmother goes into the hospital for a hip replacement, gets an infection at the site of her surgery, and dies 5 days later. This is preventable. This is really important to hone in on these kinds of things. Infections back in the day, 20 years ago, it was thought that when you opened up the human body, they were going to get an infection and there was nothing you could do about it. It was the cost of doing business. This is not the case anymore. We have lots and lots of evidence of how we can successfully prevent infections, specifically related to surgical sites, but many other types of infections. Third is your neighbor has an asthma attack during allergy season, perhaps, and goes to the emergency department for relief. The medication they give your neighbor is 10 times stronger than it should be, and he dies. This is also preventable. Medication errors, a certain type of medical error, is highly common. And so this is something that we'll talk about in a little bit. Medications and medicines are very important for you to watch. And number 4 is your brother's in a skateboarding accident, hits his head and becomes unconscious in the hospital, and they put a tube in his trachea, becomes dislodged, and he dies. This is also preventable. This may also be a good time. I just realized this in talking about this example. Today is also the 8th anniversary of Drew Hughes's death. Drew Hughes was a young boy who was in a skateboarding accident and had a dislodged tube. That was one of the examples that I thought of when writing this slide. So make sure to check out on social media different ways that you can help advance Drew Hughes's, his life and telling his story and learning about what could have prevented his untimely death. So as we kind of get in more here, you may have seen the headlines. This is back from like 2016. There was a big study that came out that said that medical errors were the 3rd leading cause of death in the United States. It was on NBC and US News and World Reports. People came out of the woodworks and were saying, oh my gosh, Ariana, I saw this in the news. And so, basically there's all sorts of estimates out there saying that there's anywhere from 200 to 440,000 people who die preventably in hospitals every single year. Now, it is, we're in almost July of 2021. We know that there's been over 600,000 COVID deaths this year. So yes, COVID has definitely replaced medical errors as the 3rd leading cause of death this year. But guess what? If we're successful and we reduce this, pandemic and get down to where people are vaccinated, guess what's going to be the 3rd leading cause of death next year? Medical errors again. So I'm going to show you a few headlines from the news of different types of medical errors, just as an example. So this is from the Mirror over in the UK. Baby died in dad's arms after bungling hospital medics made 5 major mistakes. Shrouded in secrecy, a beloved Utah mother and grandmother died after having liposuction. Why do so few people know? And medical error ends with teen's thumb replaced with toe. The last one, I just pulled this in May. Austrian man gets wrong leg amputated. So these things like the wrong site surgeries are still so common. They're still happening. An Austrian man got the wrong leg amputated. It's still happening out there. And so this is just a reminder that this is happening in our news every day. People are reporting that these issues are happening. So we have more to do. Another headline that caught my attention this last summer was from Jane O'Donnell over at USA Today. And she reported that as COVID-19 spread, the feds relaxed rules and hospitals tried to contain the outbreak, other infections may have risen. So this is something that we've seen a trend of, right? Hospitals understandingly had to focus their attention on COVID-19, that outbreak. And so because of all of their attention going to the outbreak, other types of infections and issues related to medical errors that they might have been really wanting to spend time on might have fallen to a lower priority. And lastly, this is also very timely from everything that happened last year and continues to be a movement around, care for ethnic minority patients. So the safety of healthcare for ethnic minority patients, according to the International Journal for Equity in Healthcare, says that patients from minority groups are at higher risk of patient safety events, which are events that could have or did result in harm to the patient compared to the mainstream population. And I say this because if you're listening and you are from an ethnic minority, this is something else that you have to fight, that you may not, you may be at higher risk of these patient safety events. And so you have to be on higher alert than other people from the mainstream population. So as we kind of shift now, we know that medical error is the third leading cause of death. It kills between 200 and 400,000 people in a normal non-COVID year. What we did was last year and this year, we polled the American general public and said, okay, what does the general public know about medical error and patient injuries? And what we saw was that 87.3% of people who were polled had heard little or nothing about medical error or patient injury in their local community in the last year. So you can see that that number dropped. It was actually 91% last year. So it's good. We want more people to be hearing about medical error and patient injury, but it's still a huge proportion of the population that hasn't heard very much about it. And so those headlines that I showed you are clearly not going out as much as we'd like them to in local newspapers to educate the public that these are things that you should be concerned about and you should be ready for and have tips to help prepare you to be more safe in the future. So a white paper will be coming out shortly on this topic, probably in the next few days, to be honest. We've been working hard on it over the last few months, but this is one of the main takeaways from that survey that we did. All right, so now part 3 of your safety in the hospital is some tips. This is where we'll go into some tips for you to stay safe in the hospital. So the first thing is, how can you prepare for your hospital stay? And I will say this is very hospital oriented. However, a lot of these tips can carry into your general practitioner or to your specialist. So just keep that in mind. It is pretty hospital focused, but can also impact your care elsewhere. So first is research your medical issues. And some doctors and people out there might say, oh gosh, she's telling them to research and go to Google, right? Oh, man, she's gonna tell them to go to Google and now they're gonna come in with all these ideas. Now, the thing is, it used to be so hard. You'd have to go to a library, you'd have to check out a book, you'd have to do your reading. It's much easier now for you to research your medical issues and at least come prepared with questions to your doctor. So this isn't meant for you to self-diagnose. This is for you to get to know what issues that you're having medically, to then bring that to your doctor and get some feedback. Is this what I'm experiencing? Is this what you think I might have? But again, it's always good to do research and not go in blindly. Second is to do some research on your doctor. So we have some different options here. There's healthgrades.com that you can go on. You type on the name of your doctor and it'll give you some information about them, perhaps even some ratings. I've actually updated this with 2 other resources since we last did this presentation. The second is docinfo.org. And this is a website that was put together by the Federation of Medical Boards. And so that's the kind of federation that goes across all of the state medical boards. And this is where you can actually look and see if there's any history related to like malpractice or investigations or wrongdoing by your doctor. So very interestingly, when I popped this in here, I went back and made sure that my doctor that I go see hadn't had anything. I'd never checked before. And good news was clean bill, wasn't anything on my doctor, but this can be a really helpful way of seeing and catching early if you're starting to go to a new doctor, just to make sure that nothing's funky. And the last is a ProPublica project that they did on investigating doctors. It has some other helpful information. And so I just popped that in there. Again, none of these organizations, we're not directly affiliated with any of them, but can be helpful tools when you would be searching for your doctor. And lastly would be to do research on your hospital. So I like to highlight that I think sometimes people think, well, I have the best doctor. You know, I'm going to go in for, back surgery and I have the best doctor in the whole world. That's great. But remember, it's systems issues. It's not always the doctor that's the problem. So you need to also make sure that the hospital that you're seeking care in has good outcomes. They have good systems and processes in place. And so these are 2 other resources. Medicare, which is, Center for Medicare and Medicaid Services, CMS. They have a tool called Hospital Compare where you can go in very similarly, type in your zip code and get some information about your hospital. The second link that I've included is the Leapfrog group. And what they do is they actually take Medicare information. They also send out an optional voluntary survey to hospitals, which if they complete, then they have the ability to grade and provide an A, B, C, D, or F to hospitals. And they have some very specific safety information that can be really helpful when you're looking at the big picture, right? You have this medical issue, you found this doctor, now you're going to go in and seek treatment in the hospital. Make sure all three of those lanes you've done your research on, and you feel like you have the best information possible to know that you're going to leave that hospital just as you came out, but obviously better. So knowing the possible risks and alternatives to proposed treatments is really important as another step. So one thing that you might ask is, what kind of complications might you expect? Depending on what you're going in for, some examples of that might be that you're going to have bleeding, or second might be that you're nauseous. So just ask that question. It's a really important question to ask. What might I expect? And remember, if you don't like what you're seeing, there might be an alternate treatment that you might be able to do that won't result in those complications or risks if you want to weigh those different risks between two different proposed treatments. The second is, what should you be concerned about? Depending on, again, your history, you as a person, paired with what treatment you might be going through, you might have different outcomes. You might be at a higher risk of blood clots, or you might be at risk for delirium. So that clock on the right-hand side, what they will do in the hospital is they'll have you draw a clock. And sometimes what happens is if you're delirious, you'll draw a clock like that instead of a normal one. Those are just two really important questions that you might be able to ask to know, hey, I'm concerned about this risk, and maybe there's an alternative to the proposed treatment. Okay, so let's talk about the discharge plan. So most people, when they hear that they're going to get discharged, they're thrilled, right? They want to get out. I want to get out of here. It's been loud. I want to go back to my own bed. They're like, thank you very much. See you later. But what I want to remind you is that knowing what your actual discharge plan is very important. There's lots of questions that you should be asking. There are examples here. I won't read every one of these, right? But how long should you expect pain? That's really important. If they believe that you should only be expecting pain for the first 24 hours and it's been 7 days and you're still feeling pain, that's really important for you to then follow up with your care team and understand, why are you still experiencing pain? Are there any special dietary restrictions that should be followed, right? Is there anything that you should avoid because of your treatment? So not just zoom in outside of that hospital as soon as you're able to go. You really should focus on what are the things that you should be, you and your, let's say it's your spouse or your caretaker, someone who's caring for you after. What are the things that are going to throw up a red flag that might cause you to be readmitted or seek additional care? All right, so we'll move now into what should you bring. So the first thing that you should bring with you to the hospital is your medical records. So whatever state that looks like, if it's digital and physical, just bring them with you. Part of your medical records, we're going to focus on a few different categories of kind of information. So if you don't have physical medical records, you could also put this list together probably pretty easily on your own. So your problem list. What's your problem? I have anemia, I have COPD, I have diabetes, and my main concern today is that I have a broken hip, right? So that's what's called your chief complaint. Why are you going to the hospital? You have a broken hip, you need to get your hip replaced, let's say. So problem list, what are your problems? What's your chief complaint? What's that thing that is, the main red flag? Other medical problems and treatments. So if you say that you have allergies, I have some of those other examples there: diabetic, anemic, COPD. And then lastly, previous surgeries or other related treatments. So if you've had other surgeries or other related treatments to what you're going in for, you can share what was done, how did it go? If you had any complications, make sure to share that. And if you were under anesthesia, how did you tolerate anesthesia? there may be ways for them, if you did not tolerate anesthesia well, for them to change the anesthetic and make it a better experience for you. Okay, so first was your medical records. Now it's your medications. So at the very least, a medication list is very helpful. Having the name of the medication, the dose that you take, and the frequency that you take it will be really, really helpful for your care team. And then second is, if you can, if this isn't an emergent situation where you have to go hop in an ambulance, actually bringing your medication bottles is very helpful. This can help with one specific thing called medication reconciliation, where you might be seeing multiple doctors. And if you are, you could have two medications that are dealing with the same issue. And those doctors might not know that they've both prescribed you something, let's say for diabetes. So if you bring your actual medication bottles, what the hospital will do is that the pharmacy team will look at it and say, hey, you're taking two medications for diabetes. We can drop this one and just keep you on this one. So that's the benefit of actually bringing your medication bottles. Also, if you had the list and you listed out both of those medications, they can do the same thing there. But actual medication bottles are often much more helpful. And then the last thing on this slide is there's a very helpful infographic and actually a mobile application that I'll share with you later from the World Health Organization. And they talk about the 5 moments for medication safety. And so there's 5 moments where you can focus on taking steps to ensure that you're taking your medicine properly. So first is when you're starting your medicine. Second is when you're actually taking your medication. Third is when you're adding a new medication. Fourth is when you're reviewing your medications, how long that you've been taking them, do you need to keep taking them? And then lastly is when you're stopping a medication. So there's some probably pretty small text for you here at the bottom, but I have given the source if you wanted to look at it, and I will mention the mobile application, which goes into these 5 moments a little bit later. All right, number 3, this is arguably my favorite slide. What should you bring? An advocate. And first, I want to talk about what an advocate is. An advocate is a supporter, a believer, a sponsor, a promoter, a campaigner, backer, or spokesperson. This is someone who's your right-hand person, your right-hand man or woman. And an effective advocate is really important. It needs to be someone that you trust, is willing to take action on your behalf, and someone who works well with others. Now, remember, if you have a spouse who you obviously trust, might be willing to take action on your behalf, but maybe doesn't work well with others, maybe has a short temper, consider someone else. You want someone who you can check all three of these boxes for. Maybe it's your neighbor that you see when you're watering your garden, or maybe it's your best friend who lives down the street, right? If you really want to find someone who can effectively advocate for someone, for you, we need to make sure that you are taken care of. And if you are under, you're taking medications, you might not be in a decision-making mindset, you need to find someone who can effectively advocate for you. And of course, your spouse will be a great, the next best thing if there's an emergent situation. But if you're able to pick, if you have that time, you know that you're going in for a surgery and you want to pick someone to also be alongside your spouse, these are some things for you to seriously consider. Now, I know that not everyone has a friend or family member who's down the street who could easily help you. And so there are some other options that I want to mention. One is that you can hire an advocate. There are plenty of organizations that help you based on your zip code, etc., to hire an advocate based on what you're going to be going through. And second is if you have a disability, you may also have access to advocates through what's called the Center for Independent Living. And so someone brought that up on one of the previous webinars that we've had, and I wanted to make sure that that was clear for anyone who might have a disability. And remember, the best information about you comes from you. So you know yourself better than anyone else. You should be able to speak up and advocate for yourself if at all possible. If you can't speak for yourself, then the advocate alongside you is going to be the second best option. All right, so moving into part 3, our free resources. So I'm going to go into some tips and tools to stay safe. So first is Patient Aider. It's a mobile application that Mary Michelli, who you can see on the left, she's a retired nurse and was the creator and curator of Patient Aider. She donated this mobile app to us several years ago. She kind of discovered in being a nurse that there were patients that didn't understand how to navigate the hospital. They didn't know what kind of issues they might run into and what kind of dangers there were. And so she wanted to try to put that into your phone so that you could easily, when you're at home preparing to go into the hospital, if you're in the hospital or if you're at home recovering, get some of that information that might be useful. So we really thank Mary for all of her continued support. She continues to curate and edit the app and add new topics as she learns about new tools and resources. So this is just an example of a screen about airways and ventilators. This would be really helpful if, let's say, a family member was at the bedside and their loved one was on a ventilator. This would help explain in kind of easy to understand terminology what airways and ventilators and ventilation does for the patient, and what this might give some tips of questions that that family member should ask about their family member who is on the ventilator. So just one really helpful tool. It is free. It's also available in Spanish, traditional Chinese, and Arabic. So we will be coming out with Korean soon as well. So lots of great resources for people who don't speak English as well. So we have a website on a web page on our website. The short URL is above patient.sm/patient-resources. And so these are all the different resources that we've collected over time. People have sent them to us, we found them on our own. And so instead of recreating a wheel and creating our own resources, why not just show what amazing work other organizations have done? And so a few I'll just point out is your discharge planning checklist. So I know I really tried to hit home that you don't want to skip over discharge planning. CMS actually has a really excellent printable packet that you see there in the second from the left. And then my health notebook that was created by Johns Hopkins. It's very comprehensive as well. It just has a lot of great information that you could print out and write in as you go through your hospital stay or are advocating for a family member. So these are really helpful. If we were in person and I was able to share these with you, you'd get a packet with a lot of these. Second is a whole bunch of checklists. So we talked a lot about the discharge checklist and things like that. This second one from the left as well is called being admitted to a hospital. And so these are 10 questions that you could ask. Why must you be in the hospital? What is your diagnosis? How long will I be in the hospital? What tests or studies will be done to confirm or refine my diagnosis? All of those things can be really, really helpful. The other thing that I really like to highlight is the one on the right, the Who's Who in the Hospital. This was created by the Empowered Patient Coalition. Also, I want to highlight that Dr. Steve Barker on our board is the author of that being admitted to the hospital checklist. So thanks, Steve, for putting that together. He was the chair of an anesthesia program for 23 years, I believe. So definitely coming from someone who has a lot of knowledge in that area. Going back to the Empowered Patient Coalition, I love this because there's so many people who are running around you and caring for you and interacting with you in the hospital. Understanding who they are and what they do in relation to why you're in the hospital can be really helpful. So this is just an example of, what is a hospitalist? What is the chief resident's role? What does the nurse manager do versus the charge nurse? So lots of great resources. Again, if you go to patient.sm/patient-resources, all of these are on our website for you to download for free. And another web page that we've developed over the last few years with the help of a lot of volunteerism from our advisory board and elsewhere is If You've Been Harmed. So we have on ifyou'vebeenharmed.org 10 steps for you to follow if you've experienced harm. And this can be really helpful in hopefully if someone's Googling right after they experience harm, for them to follow gathering information as quickly as possible, talking to that care team and trying to figure out if you can resolve it. all the way going down to, contacting the Department of Health or the state medical board if necessary. So I don't go into a lot of details here on the slide, but if you have been harmed or you know someone who's been harmed, ifyou'vebeenharmed.org is a really helpful resource that we've put together. A few other resources I'd like to highlight are the Question Builder, which is an AHRQ app. So that's the Agency for Healthcare Research and Quality, which does a lot of patient safety related work here in the United States. And so this app is really great because it doesn't contain any like HIPAA related information. You don't have an account or anything, but what you can do is you can put together a list of questions. There's nothing worse than getting to the doctor and you had that list in your head and you knew that there were 4 things and you only remember 3 and you've only got that 11 minutes, right? So this can help you by really organizing your thoughts and making sure that when you're in the office, you can go through your little checklist and make sure that you get every question that you had answered by your provider. The second is what I mentioned before. This is actually the first mobile application that the World Health Organization created for consumers, for the layperson. And so it's called WHO MedSafe, and it guides you through those 5 moments for medication safety that we talked about when we were talking about medication. And so this can be really helpful for you to go through on your own, and also can be helpful to kind of show to your doctor saying like, this is why I'm asking this. This is from the World Health Organization, a trusted source, right? So kind of helps the provider understand you really are going through, a mobile application that has some clout, is trusted out there by the World Health Organization. All right, and then section 4, we're going to go through real quickly some COVID-19 resources. So we're going to talk about some information about the virus and vaccines. We know that we're still in COVID times. Things are looking good here in July of 2021, but there may still be visitation limited. We know that most hospitals are allowing visitation for those who have been vaccinated or who can show that they have had COVID-19 and have recovered from it. But there may still be some areas, especially if there's an outbreak in a certain part of a country or a region, a state, there may be visitation that's still limited. And so that really impacts the ability to advocate, right? What we saw during this COVID-19 pandemic was that when patient advocates, those people who I said that you needed to make sure were going to be effectively caring for you, they weren't even able to be in the room. And so there may be still some visitation limits, as I mentioned, but there are some ways for you to access. This is the hospital plan of care. On the right-hand side, this is a resource that we developed here at the Patient Safety Movement Foundation for you to take notes as you are in the hospital. So this is a great resource for you to download. And you can also follow this plan for care from home using virtual communication if you can't be in person. So if you are FaceTiming or Zooming with someone who is in the hospital, this can still be a really helpful tool. And you can find these on the Patient Safety Movement's website underneath Education, which is the tab at the top, and COVID-19. I do also want to share that we've been updating the COVID-19 vaccination tips. So we've included information like how does the actual COVID-19 mRNA vaccine work, the difference between some of the ones that are common here, especially in the United States. And so we will continue to update this over time as new manufacturers come to be and as there's more information. As we know, there's lots of information coming at us during this pandemic, and we always want to make sure that we're providing you with the most up-to-date information. And lastly, I want to spend just a few minutes on Unite for Safe Care. So Unite for Safe Care is a campaign that we launched last year in the summer, and it correlates with World Patient Safety Day, which was developed and approved by the World Health Organization as one of their world days, kind of like World Diabetes Day or World AIDS Day. It's September 17th of every year. And this year, we're going to be kind of doing the same thing. We're going to be kind of enhancing and amplifying the message to help make sure that people like you or your friends and family members understand how to properly advocate for themselves to unite for safe care. So I'm going to play this short video. I'm going to rely on, hopefully, my team. We forgot to check this video, so let's make sure this works. But I'm going to play a real short video here on one of the ways that you, no matter who you are watching today, can get involved. Okay, so in that video, you saw people walking and wearing orange. And so those are just a few of the different ways that you can take action on World Patient Safety Day. We have 8 different ways that you can get involved on this screen. One would be to sign up for emails and just stay in the loop about what we're doing. Second would be donating if you can. We need funds to be able to support all of these initiatives around patient safety awareness building. Third would be RSVPing for events. We'll have a public event on September 17th that will be both content for administrators and healthcare workers, as well as the general public. So it's friendly to both groups, so essentially everyone. Fourth would be to join social conversations and follow us on social media using the hashtag uniteforsafecare. Fifth would be walking via charity miles. We have a mobile app that allows you to dedicate your miles as you walk and use your Android or your Apple phone to kind of lead up to, we're trying to get 200,000 miles walked via charity miles to represent each person who's died in this last year due to medical errors. 6 would be to wear orange or buy our merchandise. You saw some of the Unite for Safe Care shirts and We're All Patient shirts. And then 7th would be hosting your own walk. You saw that there were 2 different groups, one in Newport Beach, California, and one in Washington, D.C., where we planted flags and kind of all walked with wearing orange and wearing the Unite for Safe Care stuff to show solidarity. And so if you want to host your own walk in your own area, there's lots of information on our website to show you how to do that. And then just lastly, share what you'll be doing, whether it's hosting your own walk, whether it's going to be replacing your orange bulbs outside of your house and lighting them up orange. We want to know what you'll be doing. We'll put a little pin in our map online to show all the people around the world activating around World Patient Safety Day. So we're only 2 months away, and that's why we wanted to make sure that during this webinar, during the end of June, we wanted to make sure everyone knew what other opportunities there were to get involved. And lastly, in general, whether you're talking about patient safety movement or the Unite for Safe Care campaign, we encourage you to join our community. 0 is the only acceptable goal. And if you believe that's true, we'd encourage you to sign up on our website. We have lots of resources that we mentioned today through that portal, through our community website. Always advocate for yourself and your loved ones. And lastly is to share the resources that you saw today to help friends and family members who might not have been able to join today, don't know who we are, but have the opportunity to be empowered and educated patients. So with that, we will move into the Q&A. So thanks very much for your attention today.
Thanks, Ariana, for all of that great information. With that said, we have about 15 minutes remaining. So I will give the next 2 minutes, about 2 to 3 minutes for you all to submit your questions if you have any. Okay, let's see. Can you go back to the slide with app downloads on resources slide from Sandra? Give us 1 second, Sandra.
Sorry, I forgot I put myself on mute. Is this the slide that you were looking for?
Yes.
Okay, good.
And just so you all know, I know we did get a question earlier on during this presentation. This recording will be on YouTube and our website. So if you want to reference any of the helpful links that Ariana did highlight today, you should be able to pull them directly from the presentation in case you want to take a deeper dive on it. Any other questions? One thing I will say while we wait, I'm very excited that September is right around the corner, so I'm glad Ariana did highlight our Unite for Safe Care campaign. Excuse me. We do have a website. It is uniteforsafecare.org. So all of those ways that Ariana highlighted, those 8 ways that you can get involved, I would encourage you all to check out our website and again, take a deeper dive and see, what ways you'd like to activate in your local areas to help us spread our mission and our vision. Okay, so we have one question here. Why did you choose the color orange?
So great question. We didn't choose it. This was based on the World Health Organization. They picked the color. So I think that they probably had to go through all the other colors, red being AIDS related. I actually don't know what the diabetes color would be, but they selected it. So we didn't have much of a choice, but yeah, and I'll show you, these are the flags that you saw in the video. So these are what we planted all across the country, from Newport Beach, the Hoy to Washington, DC. So good question.
Great. We have another question here. It says, do you have additional learning modules for falls in the hospital?
Learning modules. So if you're talking about for the public, we don't have any modules per se. I will say that Patient Aider, if I can go back here, Patient Aider does have a section on falls. So that's probably the best way to consume information as far as, being a future patient, where you can find information about falls and how to stay safe. What I don't go into in this presentation very frequently, but I'm happy to kind of just share right now based on that question. We do have actionable patient safety solutions. We call them apps, or APSS for short. Those apps blueprints are what we encourage hospitals and other healthcare organizations, anyone who's directly providing care, to implement in order to improve patient safety. And we have one of those on falls and mobility. So I don't know who you are, so I'll just make sure that I share with you that Patient Aider would probably be the closest thing for a layperson, for a future patient or a current patient to consume information about falls. If you are coming from the clinical side, we do have the apps blueprints and the apps education as well. There's lots of resources clinically related to how to prevent falls on our website as well. So that would be under solutions if you're looking at the top bar on the Patient Safety Movement website. Hope that answered your question.
Thanks, Ariana. We have one more question. Did you guys update all information on COVID vaccine around the world?
So great question. I don't work on that page. So maybe what I'll do is I will follow up. If you can pop in your email address or a way to contact you, I will double check that. I did ask our clinical team yesterday when the last time this had been updated, and they said it had been a few weeks ago and they were working on an update, but it probably wouldn't be ready by today when I'm doing this presentation on the 29th of June. Is today the 29th? Yes. But it looks like, based on the screenshot here, we had information on Pfizer and Moderna. So it looks like we don't have the AstraZeneca one on here. So I will ask, again, if you pop in your email address, I will make sure to follow up on your question. It's a good question.
Great. And Sidra, we have your name. I have it written down, so we'll ensure that we circle back with you on that.
Great.
Perfect. And then it looks like we have one comment, one question. Christine said that she found the video of Carol Hemmelgarn's story very powerful. Do you have any specific examples that the hospital used by the family to ensure that this didn't happen again? I'll try to, I think perhaps what she's trying to ask is, following the event, did the hospitals take any measures to ensure that this didn't happen to somebody else?
Great question. And yes, it's a really impactful story. Carol does work with the organization and is on their board to ensure that this doesn't happen again. So they did come around. I still can't get out of my mind that it took 3 years, 7 months and 28 days. I think I'm saying that correctly, for them to be completely open and honest about what happened to her daughter. And so, yes, she does work with them, and they've kind of come around to make sure that they're a more transparent organization this time around. And so I guess as far as like public information, I don't know that they publicly have shared anything about this particular case, but they are working with Carol and other patient advocates on their board to have more of without going into too much detail, there's what's known as PFACs, or Patient and Family Advisory Councils. And so I believe that Carol is on that PFACs committee within that hospital specifically, as well as maybe involved in some of their other work.
Great. Okay, I don't see any other questions in here. I am getting a lot of really positive feedback about how informative this session has been. So we're really excited and happy that you all found this information helpful. I will just echo everything that Ariana said. Please feel free to take a look at our resources. All of the resources that we have available on the website are free. And then again, please check out our Unite for Safe Care campaign. And we really hope that we see and get all of your support on September 17th. So thank you very much. We'll follow up with some of the questions that we had in this chat box, and this recording will again be available on YouTube and our website shortly. So thank you, everyone. Appreciate it.
Thanks so much. Take care.